Hello, my name is Dr. Casey Scott, and I am the Deputy Health Officer for the Dorchester County Health Department. This version of COVID-19 101, an FAQ for schools and parents, will provide a critical update to the quarantine guidance issued by the Centers of Disease Control and Prevention and the Maryland Department of Health, dated December 2020. Today, we're going to review the most up-to-date CDC guidance, specifically time that one must be out of work or away from school and when someone may return to those duties. We're also going to discuss the difference between isolation and quarantine. We're going to define who a contact is and talk a little bit about how contact tracing works. And hopefully most of your COVID-19 related questions will be answered by the end of the slide set. So once someone tests positive for COVID-19, the most common question we get is, when am I no longer contagious? When can I leave my house? So on the slide, we see the most up-to-date CDC criteria. So it has to have been 10 days since the onset of symptoms, and those symptoms must be improving, and fever-free for the past 24 hours without using any fever-reducing medications such as Tylenol or ibuprofen. Now, if someone got tested and never developed symptoms, never had symptoms to start with, their 10 days starts from the day that they were tested, not from the day that they got their test results back. So now we're going to look at some different examples that will better illustrate when people can end isolation or quarantine and go back to work or school. So in our first scenario, we have Amy. She gets sick with COVID-19 on Monday. We'll call that day 0. Although she is feeling better and is fever-free on day 3, she needs to continue her isolation period for a full 10 days before she is able to go back to work or leave her house. So in our next scenario, Albert gets sick on Monday, also day 0 in this diagram. He has fever and cough for longer than Amy did, so his fever extends through that 10th day. So because on his 10th day, he's not 24 hours fever-free, he has to wait an additional day, an additional full 24 hours before he is able to come off of isolation and leave his house on day 12. In this scenario, I will introduce the concept of being a contact and being on quarantine. Please note that the guidelines to follow are new as of December 2020. This is Sasha. She is not sick, but her partner is. Sasha lives with her partner and is able to isolate even within their home. She needs to quarantine at home since she is a contact of someone with COVID-19. This quarantine period must last for a total of 10 days, as long as Sasha remains without symptoms. The previous quarantine timeframe was 14 days, which is still considered the lowest risk. However, the CDC conducted a risk assessment and determined that a 10-day quarantine is still acceptable. Now, Sasha may be interested in getting a COVID-19 test to know her status, given that she lives with a positive case. We recommend that, but she should wait until 5 days after her last exposure to her partner. If she gets tested on day 5 or later, and that test result comes back negative, Sasha can actually end her quarantine as early as day 7. But in this case, where she lives with the positive case, the person with COVID-19, she must remain away from that person until the contact is off of his or her isolation, which is 10 days total. So let's define a contact. A contact is someone who has been around a positive case within 6 feet of that person for at least 15 minutes. But furthermore, it depends on when you were around the positive case. When someone tests positive for COVID-19, we determine when their day 0 was. That is either the day that they developed symptoms, or if they never developed symptoms, it's the day of their positive test. We start looking for contacts 48 hours prior to that day 0. So a contact is someone who's been around a positive case within 6 feet for 15 minutes or more, starting 48 hours prior to that person's positive test or 48 hours prior to their symptom onset. And unfortunately, this definition of being a contact does not change based on mask usage. Additionally, that time frame of 15 minutes or more is over a 24-hour period. So if you've been within 6 feet of someone for 5 minutes at a time, 3 times over the course of a day, you are now a contact. And just in case you weren't confused by that, there are things called contacts of contacts. So a contact of a contact is someone who is a contact of someone currently in quarantine. So let's think back to Sasha's example. Her coworkers would technically be contacts of her as a contact. But contacts of contacts do not need to quarantine. The only recommendation is just like we tell the general public, please monitor for symptoms, wear a mask, and practice physical distancing. Now, this scenario is a little complicated, so we will go through this piece by piece. This is Chris, and he lives with his wife, son, and daughter. Chris's wife and daughter test positive for COVID on day 0, but they are unable to really isolate from Chris and Chris's son within the house. Therefore, the quarantine period for Chris and his son can't start until his wife and daughter are done with their isolation, which is after 10 days or whenever they meet the criteria to come off of isolation. However, Chris and his son are able to come off of quarantine after 10 days as long as they stay feeling well. If they were to get tested, they should wait until 5 days after their last exposure, or in this case, 5 days after Chris's wife is able to leave the house, or else it would not have any effect on the end date of their quarantine. Before we get into some additional scenarios and what ifs, I just want to make the point that for any positive case or for anyone who is named a contact, as long as you reside in Dorchester County, the Dorchester County Health Department will be reaching out to you as a contact or you as a positive case throughout either your isolation or quarantine period. We also provide education and can provide resources, and we check up on folks to make sure that your symptoms are improving and if you have specific questions that they get answered. That also means that we provide work and school notes for people who need it, and we never ask that you keep track of your own status. We always tell people when they're done with isolation and when they're done with quarantine. So, what if a student shows up to school with symptoms? Well, for one, we are developing some policies and screening procedures that hopefully will encourage anyone who has symptoms that even could be considered COVID-related to remain at home, and that's for students and staff across the board. But let's say a student shows up to school and on an initial screening has symptoms or someone notices they have symptoms, and this is before they've interacted with really anyone. The real key here is going to be isolation of that student and discharge to home. So that means that each school will need to designate a certain area for students that need to be isolated. Each school will designate a staff member. It most likely will be the school nurse who will interact with that student and only do so while wearing appropriate personal protective equipment or PPE. And the main goal will be to get that student home and to have an evaluation by their personal health care provider. So then what if a student develops symptoms while at school? This is where the school nurses as well as the administrative team will use the decision aid that was made jointly by the Maryland State Department of Education and the Maryland Department of Health. This decision aid helps to figure out which students have COVID-like illness and which students might simply have something else, such as allergies or common cold. In either scenario, a child will still be sent home, but determining whether or not they have COVID-19-like illness or not is important in determining when the child may return to school, if testing should be done, and if anyone else at school needs to quarantine. So then what if a custodian who covers multiple schools develops symptoms well into his or her shift? So I think the difference with this scenario is that perhaps the custodian doesn't have as much face-to-face contact with the school population as a whole, and we're more so talking about someone who might have COVID and their presence within a building, and what does that mean? So the presence of a COVID positive person within a building does not necessitate a building closure per se. This is really where, again, isolation and discharge to home is important, as well as that contact investigation. And in this case, we may be more worried about the custodian's coworkers and people that they share shift duties with compared to other school staff or students. And so also in this case, we might want to take a closer look at cleaning the surfaces that were commonly touched by this individual, as well as the students who might test positive in the earlier what-if scenarios, just to make sure that all surfaces are being disinfected often and with the appropriate cleaning supplies. So then what happens if one of our kids is named as a contact and has to quarantine? What are we supposed to do then? So that's when we find ourselves as being a contact of a contact. And contacts of contacts do not need to quarantine. So realistically, this scenario depends on the age of your child and how much that child can do independently. I think it's an important point to bring up among staff, though, just so that everyone knows what's expected of them and to have a good plan for how people might be able to transition into teleworking versus working in the office. Okay, so what if I test positive and follow the health department's recommendations, complete my isolation period? Do I need to be tested again? So at this point, the thought is no, not for at least the next 90 days. Now, this may change over time because we are always learning more information about what we think of the immunity or our immune response to this virus. But at this point, it is not recommended to require people to have a negative test before having them return to work. We are using the time-based strategy, which is the 10 days from symptom onset or time of test plus 24 hours fever-free. And it is not recommended to be tested again within a 90-day period of the first positive test. So I leave you with this take-home point. Do your best to keep your distance. While the time frame for isolation and quarantine is now the same at 10 days, what we are seeing at a county level is that new cases are naming multiple contacts. So we are now having to call and quarantine many people who may never develop symptoms of COVID or who may never develop COVID at all. And being home on quarantine for 10 days when you're feeling well, when you'd rather be working, is pretty disruptive. So one way that you can protect yourself from that is to do everything you can to keep your distance. I leave you with these last 3 slides of reputable resources that I encourage you to bookmark and check frequently. The first is the Maryland Department of Health, where you will find state-level data, charts, graphics, trends, information that the governor uses to make decisions about the phasing of reopening. Number 2 is the governor's office, where you will find all of the executive orders as well as guidance on those executive orders and all press releases related to Governor Hogan's announcements. And then the third one is the CDC, where all of the clinical information is stored, as well as information for schools and childcare centers and guidance. On the next slide, local resources include the Dorchester County Health Department webpage as well as our Facebook page. Please follow us for local updates. We update every day with a very detailed case count. And on the very last slide is all of our contact information, our email address, our call center line. We are here to support you. We want to reopen safely, and we want to make sure that you feel comfortable to do your job. Thank you very much.